So another question we get about deep plane facelifts is, who is a good candidate? So that is an extremely personal decision. We have done this operation on a patient who's 38, and we've done it on someone who's 78. Huge range. The thing that I always look for to see as someone a good candidate is, what does their anatomy need? What are their goals? Are they trying to get structures to come up and be lifted to rejuvenate? Then that's surgery. And then it's just, what type of surgery are we offering for that patient? If they are more referring to some type of a skin issue, lines in the skin, a little bit of textural change, that's not a facelift. That's some type of a skin treatment, whether it's a laser or some type of a chemical peel or even injectable. So these are different goals. So the key thing is, what are the goals and what is the anatomy saying? It has nothing to do with age whatsoever.